Good afternoon, everybody. I hope you guys can hear and see me well. So welcome to this event, which is the Introduction to Medicine at St George's University of London. My name is Lanisha. I'm the Events Officer at St George's, and I'll be the host for the event today. So throughout this event, you'll be able to hear and see all of the speakers, but we won't be able to hear and see you. So if you have any questions for us from now until the end of the event, you should all have a chat box or a questions box on your screens. So please use that to send in any questions you have from now all the way until the end of the event, which is at 5:30. So you would have all seen the schedule beforehand, but I'll just reiterate it now just so you know. So the schedule for this event will be, after this introduction, you will get to meet our current students. So that's 4 or 5 of our students on the course. You will then have a presentation from one of the admissions tutors for the course, Laura Byrne. And then following that, I will play a video for you guys from the student support team, so you can hear about our student services. So that's things like finance and accommodation. And then you will hear from the Vice President of our Students' Union, so you can hear a bit about our Students' Union and the facilities we have on site. Finally, we will have a Q&A session. So any questions that you guys send in at that time or during the event that we haven't typed responses to, we will answer those questions live on air. So that will be myself, the current students, and our admissions tutor, Laura, as well, will also help us answering some of those questions. And then that will be the end of the event at 5:30. So what I will say to you guys is, if your connection cuts out, please do try and log back in. We will be here up until 5:30. If for whatever reason you're unable to log back in, this event is being recorded. And I believe as registrants of this event, you'll get a link from GoToWebinar to the recording, but we will also house this recording on our website. So if you go to the St George's website and go to our webinars page, you'll be able to see all of our webinars there, including this one in a couple of days. And we will also have this webinar on the St George's YouTube channel, so you can view it there also. At the end of this event, you all have a short survey that will pop up on your screens. And I'd be very grateful if you could just take a few moments out to fill in that survey and give us some feedback about this event so we can improve future events that we have for potential students. Okay, so that's the end of my welcome. As I said before, please do send in any questions you have from now until the end of the event, and questions about anything, admissions, student life, academic studies, whatever it is, send it in and we'll try and get those answers out to you. Any questions that we're unable to answer through typed responses or live on air, we will send an email out to all registered guests with answers to any unanswered questions. So if for whatever reason we're unable to answer your questions, maybe because the volume is high or we need to research specific, data to get that answer for you, then we will send an email out to all registered guests at the end of the event. Okay, so next I'm going to invite all of our current students to turn on their cameras so you can meet them. Just give them a few seconds. Excellent. Hi, Fahima. Hi, Charlotte. Hi, Mohammed. We have someone else there coming in. I think that could be Mohib. Yep. Hello, Mohib. Okay, so why don't you guys all introduce yourselves? Do you want to start first, Mohib?
Yeah, sure. So my name is Mohib Raza, and I'm 25 years old this year, and I'm a final year medical student. So that means I'm in my final year. I've actually just graduated yesterday. So I've just finished medicine. I'm about to start working as an FY1 doctor. And I chose to study this course at St. George's because there's quite a few reasons, actually. The biggest one was that St. George's is in London, and it's quite a small university, and it's really specialized in medicine. So it's got this great community feel, and it's something that particularly focuses on the course and has a great dissection program and a lot of other things that really appeal to me. It's really well located, like a fact that it's located in Tooting, which is so close to London, and it's got a lot of amenities, a lot of restaurants, places to eat, things to do around Tooting, and just a 30-minute ride from London. I like all of that about St. George's. One thing that I felt like I wished I knew before I started the course was that sometimes when you study medicine, it might seem really overwhelming, and because of that, you end up sort of becoming really sort of isolated. You start studying medicine all the time, and it can be all-consuming. But that does not need to be the case when you study medicine. This is something I only realized a couple of years into the course, that a good balance of a social life as well as sort of other activities other than medicine, like sports and just being part of other clubs and activities, are equally important, and in fact can enhance your sort of studying capability for medicine, as well as they sort of prevent burnout and give you something else to do. So that's my 2 cents on studying medicine and who I am.
Thank you, Mohib. Fahima, would you like to go next?
Yeah, sure. So I'm Fahima, I'm 23. I'm currently in my 4th year of medicine. And I chose to study medicine at George's just because I really like the location. It's really close to kind of like central London, like by tube and things. But it's also not in central London, so it's kind of like a less busy area. I quite like that about George's. And I think what I like most about George's is probably like the community feel, because there's not as many students as other universities, so you kind of get to know a lot of people quite quickly. And then I think one thing I wish that I knew before is more about the societies here, because I feel like I could have benefited from knowing a bit more about kind of the sports societies and stuff, because I didn't really get involved with those things in first year when I could have, because I had more time. And so yeah.
Thank you, Fahima. And Mohammed?
Hi, I'm Mohammed. I'm also, like Mohib, a final year medical student who just finished. Yeah, so I'm 23 years old, and I chose to study medicine at St. George's for a number of reasons. The first is that it's in London, and like Mohib and Fahim have also mentioned, it's quite close to central London, but it's on the outskirts, so it's slightly cheaper to live here than it is, for example, central London. One thing that I do quite like about St. George's is that its core structure's quite good. The first 2 years of medical school are pre-clinical medicine, and it gives you a good foundation and a good grip to when you enter your clinical years. And the clinical placements are generally well organized and well run, and that's something that I also quite like. The one thing I wish I knew before studying or starting medicine is probably a similar thing to what Mohib said before. It's just trying to balance out both, studies and also trying to socialize, as and when. And thankfully, the societies at St. George's are very good, and it enables you to do that. So trying to get stuck in earlier on would have been helpful, but irrespective, in hindsight, it's good to know that St. George's offers that. So yeah, that's what I'd like to say.
Thank you, Mohammed. And Charlotte?
Hi, I'm Charlotte. I'm 19 years old and I'm going into my 2nd year of medical school at George's. So I chose to study this course at George's because I think like they have really good early years placement. So in the first 2 years, I've already done 2 weeks at hospital. So it's not just science. You get to learn the clinical skills, you get to speak to people, the patients as well. I guess what I like most about George's is, like everyone mentioned, how it's like a family, how supportive everyone is, especially the older years. So they'll talk to you, they'll tell you, oh, this exam might be a bit like this, things like that. And I guess one thing I wish I knew before studying, so I hadn't done a degree before, and it's a big difference. The demand between doing a degree and doing your A-levels is very different. So I wish I'd kind of done a bit of research into how to study at a degree level, because suddenly you've got a lot of content and like half the time to do it in. So maybe I wish I'd done a bit of that.
Awesome. Okay, thank you guys for your introductions. So our students are going to be in the background helping to respond to questions that you guys send in through the chat or questions box. So if you have any questions for them, please do send them in, but you will see them all again when we have our Q&A session towards the end of the event. So thank you guys, and we'll see you again later. So now what we're going to do is move on to the next session, which will be our presentation by Laura, who is one of the admissions tutors on the course. So Laura, if I could ask you to join me on screen. Hi Laura, thank you.
Hi everyone. I'm just going to share my screen. So yeah, my name is Dr. Laura Byrne. I'm a consultant in HIV medicine and I work mostly in St George's Hospital, but I'm also an honorary senior lecturer at the university and am one of the 2 MBBS admissions tutors. So I'm going to talk to you a bit about the course and hopefully be able to answer some of your burning questions. Firstly, I want to say a big welcome to you all. Thank you for taking the time to find out about what St George's Medical School is all about. I'll talk to you through a bit of history of St George's, talk to you about the course structure and the curriculum and why we think you should apply here, and tell you a bit about the admissions process. So the original St George's Hospital opened in 1733 in a place called Lanesborough House, which is actually on Hyde Park Corner in central London. The hospital was arranged on 3 floors and accommodated only about 30 patients in 2 wards. From the early days, a limited number of pupils were permitted to study under the physicians and surgeons. And from the archives, the earliest recorded lecture was given by Sir Everard Home sometime before 1803. John Hunter, who was a very eminent anatomist and surgeon, began studying at St George's in 1756, and he is credited with transforming surgery into sound medical practice based on detailed anatomy. Edward Jenner was a student from the 1770s, and he went on to perform the first successful vaccination for smallpox, which has recently become very important again with the outbreak of monkeypox, because the smallpox vaccination is one of the things they're using to control the current outbreak. St George's still owns the hide of Blossom the cow, which you can see here, used in Jenner's smallpox experiment. The medical school was formally established in 1834 in Knightsbridge, again in central London, and the official opening ceremony featured the dissection of an Egyptian mummy in the anatomy theatre. During World War II, St George's became a unit of the emergency hospital service, providing 200 beds for ward casualties and 80 beds for the civilian sick. And after the introduction of the NHS in 1948, plans were laid to rebuild St George's on its current site, which had been the sites of the Graves Fever Hospital and Fountain Hospital here in Tooting. Building started in 1973, and in 1976, the first phase of the medical school opened, admitting 80 students. So I'm going to talk a little bit about diversity and inclusion at St George's University. So the first 4 women were admitted in 1915 after a big hoo-ha, because it was at that time very controversial and difficult for the women to persuade the authorities that they should study medicine. Just over 100 years later, the makeup of St George's looks very different. 2/3 of students and 60% of our academic lecturers are now women. And of course, in 2015, Professor Jenny Hyam became the first female principal to serve at St George's, and she also became the first woman to be elected chair of the Medical Schools Council. Diversity is one of our strengths. We're embedded in the community we serve, and that's also reflected in our staff and student population. I've put the reference here on the slide, but you can read more about equality, diversity and inclusion on our website and the actions that we've taken as an institution following Black Lives Matter. So we're committed to offering you a transformational educational experience. We feel that our course produces confident and resilient doctors who are ready to work effectively with their colleagues, who provide excellent and compassionate care and who are equipped to adapt to the rapidly changing science and society. And we pride ourselves not only on looking for applicants with academic success, but also for those who share our values and have the potential to develop the right skills from a well-rounded base and who are ready to be nurtured towards success. By joining St George's, you'll be part of a diverse group of students and alumni who share our values, and these are just a few alumni who've gone on to do really interesting things. Here, medicine alumnus Dr. Timothy Ho, whose career in the NHS spans 30 years, was recently awarded an MBE in the 2021 New Year's Honours List. And this award was in recognition of his service to the NHS during the COVID-19 pandemic and his work as a medical director at Frimley Health NHS Foundation Trust. Graduates of St George's Medical School also include Professor Helen Stokes-Lampard, who served as the chair of the Royal College of General Practitioners and is currently the chair of the Academy of Medical Royal Colleges. And here we have Professor Frank Chinegwundo, MBE, who is a consultant urological surgeon who now practices at Barts Health NHS Trust in East London. And he specialises in prostate cancer care, raising cancer awareness, especially within Black and minority ethnic communities. And this is Mohammed Akhtar, who is a GP and lecturer in East London. He grew up in Saudi Arabia. He got involved in running the Islamic Society here at St George's and launched the first ever charity week in 2003, which now raises more than £1 million every year internationally. And he's now the vice chair of the British Islamic Medical Association. So we can't talk about St George's without talking about what it's like to live and work in Tooting. Tooting is a really vibrant and diverse corner of southwest London. It has excellent transport links and a buzzing food and drink scene. Tooting is famous for its huge selection of South Asian eateries, but it also has a range of gastropubs and cafes and other places to eat. And it's one of the star attractions is Tooting Beck Lido, which is a Grade 2 listed Art Deco open air swimming pool and is actually England's largest freshwater swimming pool. Tooting also has its fair share of green spaces, Tooting Common being an oasis of tranquility only 10 minutes away from the tube station. So now I'm going to talk to you a little bit about the course, the structure and the curriculum. So the course is summarised in detail on our website, and I would recommend that you go and have a look at that. We've got a brochure, but also lots of other information on the website that will give you more details. Here is a graphic showing the layout of our course. So because we have a 5-year course, which is open to both school leavers and graduates, and we have a 4-year course, which is open to graduates, the clinical sciences for these two streams are separate. So the 5-year course has 2 early years, 2 early clinical years, and the 4-year course has 1. And then both of the streams meet in transition year, which is the start of the clinical practice years. The course is patient-centered from year 1 with early clinical experience and embedded clinical and communication skills, training and case-based learning from the outset. And as I said, the 2 streams merge together and you go into T year, which I'll talk about a bit more. And this is designed for students to transition into the clinical practice. And then we have penultimate year and final year, we call these P year and F year. So this is an overview of how the curriculum is structured in the first couple of years, the early years. There's an introductory module which covers a bit of everything, and then you go into these life modules which correspond to different body systems. So for example, life control here is about the brain and mind, and life support is about the musculoskeletal system, and life protection is about infection and immunity. There are 3 themes which run in parallel to these body systems: professional skills, professional knowledge, which basic and clinical sciences, and professional knowledge, patients, populations, and society. In each of these modules, there is a lot of focus on the professional knowledge that you need, the basic and clinical sciences, the structure and function of the body in health and disease, and of course, the response to treatment and outcomes. In parallel to this, we also look at the broader context in a theme we call patients, populations, and society. This covers epidemiology, public health, the legal and ethical frameworks in healthcare, and also the NHS and other health systems that help to deliver care. Again, in parallel to the life systems, we're developing your professional skills as a doctor, and this is particularly how you communicate effectively and sensitively with patients and colleagues, taking histories from patients and performing clinical examinations and procedures. We've developed a very broad range of teaching methods to help you learn, with a mixture of lessons delivered to the whole cohort, with some mixed into professional groups because we're a healthcare university, supported by early patient interactions and later on in the course simulation. Throughout our curriculum, we've long had technology enhanced learning. This was embedded even before the COVID pandemic. We have a long established learning technology team and newly appointed expertise to develop this even further. We use a broad range of approaches. Some of them are listed here on the slide. This includes our virtual learning environment, Canvas, which can be used on a desktop, a tablet, and a phone, and is easy to navigate and user-friendly, providing you with 24/7 access to all of the course materials. Canvas has allowed us to create online learning journeys for particular topics with embedded videos and quizzes to enhance learning. We even have a COVID-19 course, which includes a virtual ward round developed by one of my colleagues, who's a professor of infectious diseases. We also use Panopto to record all our lectures and make sure they're accessible online 24/7, so you can rewatch all your lectures whenever you want, when you want to revise. We already have 16 what are called massive open online courses, or MOOCs, with a wide range of subjects, for example, genetics and organ donation, available on the FutureLearn platform, and you can have a look at these now. We use an electronic portfolio to verify your skills and learning whilst you're on clinical placements in the later years, and many of our tutors use interactive tools such as Mentimeter and Kahoot to engage you in sessions and gather your feedback. We have a very well-stocked library with a full range of higher education resources and training materials, including a broad selection of online resources, including Atkins Video Atlas of Anatomy, which is very popular. So, as with all universities, the impact of COVID has meant that a lot of these teaching methods were converted to online delivery. Many of these sessions listed on this slide are now being delivered on MS Teams, and this has happened fairly quickly and seamlessly, great for teaching for large and small groups, utilising built-in activity tools and guided by the university's framework for online education. We are also making use of some openly available resources such as Speaking Clinically, which you might have already come across. It's a huge number of videos in which patients talk about their conditions. It's actually something that you can watch before you apply. It's a really valuable resource. These are already in the public domain, but we've now embedded them into our own online learning environment, where the academic team have developed new modules to replace the practical and placement experience that we are not able to offer at the moment. We have developed very well received virtual anatomy lessons, where our anatomists have video dissection or prosected resources and overlaid the images of the dissection or prosection with X-rays and 3D computational graphics to aid learning and engagement in anatomy. And some of these new virtual learning sessions have been the most highly rated teaching sessions that we have. We've moved key sessions such as clinical skills teaching back to on-site as quickly as we could, and clinical placements were only affected in the pandemic for a short amount of time. So now we're moving back to business as usual in terms of COVID. Some of the online teaching will move back to being delivered face-to-face. However, as I said already, student and staff feedback has shown us that actually online delivery is the most suitable mode in many cases. So moving forward, we'll continue to deliver a hybrid curriculum. So just to remind you again of our course structure, I'm going to talk a little bit about the clinical years now. So during the 3 clinical practice years, our students learn to perform 15 types of workplace tasks and activities, which are collectively known as the St George's Clinical Practice Outcomes. Each clinical placement will also have a list of priority conditions, known as the clinical priority list. We encourage students to focus their placement activities around this clinical priority list. So this enables self-directed learning in the clinical placement. Students collect feedback from the health professionals who supervise them using online tools to develop their doctor as a professional domain as they progress towards their final year standards in their outcomes. So T-year or transition year, during this year, our students make the transition from the academic environment to learning in the workplace. The key outcome of the T-year is to learn effectively and safely from direct patient contact, thereby establishing the trust of both patients and colleagues. The learning environments are varied and include PBL units, clinical placements, a clinical lecture series, and a 3-week student selected component or SFC. Next is P-year or penultimate year. So P-year is a very long year. It's already started for the new academic year actually, and that's because it features a large number of clinical rotations. So you rotate through senior medicine, surgery, palliative care, neurology, neurosurgery, neurorehabilitation, psychiatry, obs and gynae, and paediatrics. Placements are both at St George's and also our partner local or regional trusts. And all placements have a half or 1 week teaching programme at the beginning based at St George's. Students use these placements to extend the scope and depth of their learning in specialty placements and senior medicine and surgery. Students are encouraged to concentrate on practicing their clinical interviewing and examination skills and start to develop the ability to form a differential diagnosis and a management plan for their patients. So finally, F year or final year. This is a really exciting year where the students are supported to achieve the standard required for foundation practice and expand their horizons with an elective, a final year student selected component, and a public health firm. During the assistantships in medicine, surgery, and general practice, a one-to-one apprenticeship with a foundation doctor allows students to achieve the standard of teamwork and clinical practice expected in foundation years. So essentially the assistantships you are shadowing a junior doctor, you're part of the team on the clinical placement, and you're working towards your competencies to be an F1. Rotations in critical care and anaesthetics, accident and emergency complete the F-year programme, and competence in foundation year clinical procedures is also achieved during the clinical components of this year. So we also offer flexible optional intercalation for the 5-year course. You have the opportunity in your 3rd or 4th year to undertake an intercalated BSc of your choice, or for some students, even an MSc after the 4th year. You can study here at St George's, or you can apply to study somewhere else. An intercalated degree, although it's completely optional, allows you to advance your coverage of a variety of topics and undertake in-depth research. And you are supervised by academic and research staff in individual research laboratories and institutes here at George's. Entry is competitive and selection is based on academic results. We have several thriving research institutes at St George's where you can complete your IBSc or IMSc. REF is the system for assessing the quality of research in UK universities and higher education colleges. And in REF 2021, we had doubled the number of world-leading outputs compared to the last REF, and we were ranked 8th out of 129 universities for research impact, which we were very pleased with, being a very small healthcare-focused university. So why should you apply to study medicine here at St George's? Well, we think there are several very good reasons. We think that St George's is a great place to study medicine. We're the UK's only dedicated healthcare university, and we're co-located with a big, busy NHS trust, so you're thrust into the centre of the clinical environment right from the beginning of the course. We have a modern, adaptive course, and we're embracing new ways of teaching even before the pandemic hit, with learning technology embedded all the way through. You will be taught by a passionate group of academics and clinicians, both at the university, St George's NHS Trust, and our other partner organisations. The extensive experience of our teaching team spans the full breadth of medical and surgical specialists, GPs, biomedical scientists, and research scientists. For example, our transition year or T year is led by an A&E consultant, the penultimate year is led by a renal and acute medical consultant, and the final year by a urological surgeon. Course director, Professor Hannah Koch, is a consultant neurologist at the Atkinson-Morley Regional Epilepsy Network based at St George's, and she specialises in epilepsy treatment and research, as well as medical education. Enrolling at St George's will mean living and studying in a lively and vibrant area of South London with amazing food and drink, outside spaces and great transport links to the centre of London. The complete university guide consistently ranks us among the top medical schools for graduate prospects, and 80% of our students surveyed were satisfied with the course. So now I've persuaded you all to apply, I'll talk a little bit about the admissions process. So for the 5-year undergraduate course, which is open to is made up of mostly school leavers, but is also open to graduates. So all of our admissions criteria are stipulated on our website in great detail. So I really do encourage you to have a look at our website and the entry criteria, because we are as transparent as possible about the process. So the A-level requirements are A-star, AA to AAA. So it will depend on what offer you get. And we need you to include chemistry and biology, and you need to have done these at the first attempt and within the past 5 years. And then we want 5 GCSEs grade 6 or above, must include English language, maths and science. And then you need to sit the UCAS exam, and we're looking for a minimum of 500 or above in each section. We're not yet using the SJT section. For reference only, the interview cutoff, so the UCAT cutoff varies from year to year depending on how many applicants we have, but we published, for transparency reasons, the previous year's cutoffs, and they're all on the website under admissions data, if you look for that on the website. So for reference, the 2021 interview cutoff was 2,620. So obviously I haven't put this on the slide, but graduates can also apply to the 5-year course, and we will be looking for a 2-1 in an undergraduate degree. So we also have a contextual admissions policy, which is incredibly important for school leavers. So some people will be eligible for what we call a contextual offer. So this is an offer which can be up to 2 grades lower than.
Sorry?
Oh.
Now I might just get a drink.
Please, can you mute your microphones? Thanks. You still have to meet the other eligibility criteria. And in order to qualify for one of these contextual offers, you need to meet 2 out of 4 criteria. So you need to be, so one of the criteria is you need to be going to an eligible school, and there are 2 different criteria for schools. So you could be going to a school where they have an average A-level result of a C or below, or you could be going to a school that has low progression to higher education, and you can find a link to the list of eligible schools on our website. The other criteria are that you live in an area with low progression to higher education, so that's based on your postcode, and you can, one of the last criteria is that you live in an area with higher levels of deprivation, and that's also based on your postcode. And this contextual admissions policy is all laid out clearly on our website. So finally, I'm going to talk a bit about work experience. So I'm sure you all know that in the COVID pandemic, it became really difficult to get face-to-face work experience. So all of the medical schools relaxed their work experience expectations, and we are still relaxed in our requirements to work experience. But when you're interviewed, we still want you to demonstrate a realistic understanding of a career in medicine. We want you to have some understanding of what it's like working in a responsible role, which is public facing. And we want you to be able to demonstrate values, attitudes, and behaviours which will make you a good doctor. So you can use any experience or activity to evidence these values, attitudes, and behaviours. So that could be talking about the volunteering or community work you've done, books you've read about life in medicine, the healthcare system, podcasts you've listened to, TV programmes you've watched, and there are several documentaries which have been filmed at St George's. And I'd urge you to check out the Medical Schools Council, GMC and NHS employers' websites to read around the issues in the NHS and get a good understanding of what life is like as a doctor. So there are some online resources for online work experience, which I've listed here. But I'm really happy to say also that very recently, St George's has launched face-to-face work experience again. So that's St George's Hospital, not the university. So if you're interested in doing work experience at St George's Hospital, then you can email work.experience@stgeorges.nhs.uk. So that's great. So we are going back to business as usual, and you may find that you are now able to access work experience that hasn't been available for the past couple of years. So that's all of my slides. Thank you so much for listening, and I will be around to answer questions in the Q&A session later.
Thank you very much for that, Laura. That was very informative. So as Laura said, she will still be around to answer some questions. She might type some responses, and she'll also be around for a Q&A later. So if you have any questions about anything she has said or anything at all about applying or studying at St George's, then please do send in your questions. I can see so far throughout the event that you guys are sending in your questions thick and fast, and keep them coming. We will try to get through them all before the end of the event today. So please keep your questions coming.
It's just sign it for.
Okay, so what I'm going to do now, slightly ahead of schedule, is I'm going to play a video for you guys. This video is from the Student Services team, and it gives you a nice overview about the services that we have here at St George's for students, a bit about finance, accommodation, and things like that. So if you just bear with me for a few seconds, and I will get the video up for you. Thank you very much.
Hello everyone, my name's Gavin Taylor and I'm the Head of Student Services here at St George's. Today I'm going to talk to you about some of the support services that we have for students here at St George's. Many of the services we offer are badged under our Student Centre or Student Life Centre banners, and these include things like health, well-being, learning support, finance and accommodation services. Let's have a look at each of those in turn, and I'll give you some highlights of each of the services as we go through. So the first place to start is health. And let's talk about occupational health. Now, the occupational health team are there to ensure that students and staff are fit to undertake their work or their study alongside patients. And they're the ones in the application process who will ask you for reports about your health and will undertake tests and vaccinate you as necessary. OH are also there to make sure that any health conditions that might affect patient safety are appropriately managed. So they don't vanish on day one of your course. They're with you all the way through and all the way through your career, in fact, to make sure that you are healthy and okay and all right to work with patients. Now, universities will take a variety of different approaches to supporting the health of their students. You may find if you've been looking at large campus universities, they've got a health centre there on campus. At St George's, because we're an urban university, we work closely with our local GPs, and there are about 20 of them within about a kilometre of the St George's campus, to ensure that everyone has access to all the services that they need. Most of the local surgeries will actually come onto campus for our Freshers' Fair in your first week, and they'll get everybody signed up there and accessing their services as they go through. That's how we approach your health while we're studying. Moving on to look at student well-being. So the place to start with this one is your personal tutor. So every student at St George's is assigned a personal tutor from the very first day. Now, tutors have an academic role. They'll be giving you some of your assessments while you're in study. They also have a very strong pastoral one, so they're there to make sure that you're okay and succeeding and doing your very best right the way through. And that's a big strength of the size of St George's. Our small size lets us offer that to everybody, and I think it's a real strength of what we do. Now, as well as your tutor and as well as the specialist staff on my team in the Student Life Centre, St George's has a very large, for our size, and very well used counselling service, as well as a psychiatrist in-house to support students' mental health. We've also got a thriving faith community for a science-based university, and a chaplaincy that looks after both the university staff and students and the staff at the NHS Trust as well. And we work closely with our students' union in all kinds of different things, from faith right the way through to all the different activities that they offer, to make sure that there's a comprehensive network of support within the SU and the university and the trust next door, and all the way through all around our students while they're studying with us. From wellbeing, let's have a look at some of the learning support that's on offer. So again, universities will have different approaches to writing and study skills support, but all of them will have some. Here at George's, we operate an academic success center, and that's led by 3 senior lecturers who are there to really make sure that every student at St George's does as well academically as they possibly can. That includes all kinds of different things, from English as a second language support through writing skills, and even A-level refresher catch-up sessions for our graduate entry students. So if you're feeling a bit rusty in the chemistry or the stats, they'll get you back up to speed when you start with us at George's. We also believe that we've got an ethical as well as a legal obligation to support disabled students. Now, I do get approached from time to time with students concerned that their disability may be a barrier to them taking up their place in a healthcare profession. So just to say from the outset, there are very few, if any, barriers to disabled people entering the healthcare profession. There's really no barrier there. And our aim is to ensure that our support is just as rounded as possible to make sure that everybody is supported. And that includes the academic dimension as well as the clinical placements and other things that you'll be doing, as well as all the stuff that surrounds those things, like your housing and other things as well. Now, it is worth just saying that talking to us early if you're disabled really does help us make sure that everything is in place to start supporting you from the very beginning of your studies. It can take a while to get everything up and running and in place that you need. So please do talk to us nice and early so we can make sure that everything is up and running and going. Now, it's also worth just saying that some students, about 50% of people with a specific learning difficulty, find that out at university. And so we offer free assessments to all students and free specialist support as well, if that's the situation that you might find yourself in. So let's have a look at finance. So I guess the first thing that I'd like to say here is really just to reassure you, there are 2.5 million university students in the UK at the moment. Now, these are folk who are on the same financial footing as you will be when you are studying. The amounts of money involved in higher education at the moment are daunting. Student loans are large, fees look big. And there's a lot to think about, but just remember there are 2.5 million people who are managing okay on it. It's not necessarily an easy thing, but it is a thing that people can do, and you can do it too, and we are here to help you do it. So just some things to keep in mind. UK tuition fees are currently £9,250. They are largely set by Parliament. Will we see things change in the next few years before you start? That's a possibility. And we'll communicate that all the way through. But just for the moment, the data we've got 9250. Maximum maintenance loan. So this is for UK students who are living away from the family home in London. The maximum amount you can get in a loan from Student Finance England is £12,382 per year. And also just to note that students who are undertaking training towards allied health professions, so physiotherapy, radiography, paramedic science, and include indeed our colleagues doing midwifery and nursing, they're also eligible for a bursary from the NHS of £5,000 per academic year as well. Now, if you're taking out a student loan, there are no upfront costs for attending university. So the Student Finance England or the Scottish equivalent or the Welsh equivalent or the Northern Irish equivalent will pay for your fees. And everybody is guaranteed to receive that loan if they apply for it. So if you're a UK student and it's your first degree, if you're not taking a degree an undergraduate degree for the second time, you are eligible to have it funded by government. Now, the loans that you take out, both for your tuition fees and for your maintenance costs, become repayable after graduation once you're earning more than £27,000 per year. Also, just to note that tuition fee and maintenance support is available for all of the programs at St George's, including graduate entry pre-registration courses. Now, you may have heard that, indeed I've just said, that there are limited funds for people who are doing a second undergraduate degree. Now, just to note that for MBBS5 for the graduate entry medicine program at George's and the MSc physiotherapy program, they are exceptions to that rule. So those courses are fully funded from a variety of different means for your studies for the years that you're in. So do bear that in mind. Also, just to add, hardship funds are available for all students. We've got a pot of money aside for students who find themselves in unexpected difficulty while they're studying, as will most places. If you find yourself in financial difficulty at any point, do just get in touch and we can help. Now, there are some things that you can start doing now. So I think we're quite early in the application process as I'm talking to you today. So there are some things to get underway with. I think the most important one of those is to get a budget together for your tuition and maintenance costs and for the amount of money that you might have coming in. Now, there are some great budgeting tools and some finance calculators available online to help you do that. You can find those by checking our website. We'll point you at the various calculators, or the NHS one, or the Student Finance England one, or just Google them. There are loads of things out there, and you can work out within about 20 minutes of online searching just how much you're likely to have as income and how much you're likely to spend as a student living in London, and let you work yourself out a budget for the years that you'll be in study. It's really important to do that. It's also a really good idea to look at other sources of funding beyond Student Finance England or the NHS. There are a huge number of trusts and charities and other organizations that are there to support students in higher education, especially those students that are doing healthcare courses. So do get out and have a look for those as well. And then lastly, a quick look at accommodation. So things to know there. Most undergraduate students, certainly at St George's, live in halls of residence with us in year one and then move out into private accommodation nearby in subsequent years. That's the typical pattern. We own our own halls of residence, Horton Halls. It's about a mile away from the university main campus, and it houses 480 students. That's about 80% of our first year intake who live in halls of residence with us. Now, we guarantee places in halls to our international students, disabled students, and students with other welfare needs. We prioritize places for all other first-year students. That includes graduate entry medics, that includes master's physician associate students, that includes MSc physiotherapy students. We have great thriving communities of our graduate entry and postgrad students in halls as well. Our halls is for everyone. Similarly, we don't prioritize places based on postcode or distance from campus. So we are looking for folk who want to get away and have a moving out of home campus-based university experience, even if they live in London already. We're here for you. In terms of rent, to note, we benchmark our rents against local private housing as well as other halls of residence. There's been a great boom in the recent years of private companies coming into the student residential sector. That has driven prices up. What we do is we make sure that we benchmark against what housing actually costs in our local area, not just what housing costs look like in higher education. And we keep our rents firmly under control that way. I'd never argue seriously to anybody that staying in halls of residence, even with us, was an inexpensive option. But I would argue, looking against local rents, we certainly are a less expensive option in a lot of cases. And halls is an extension of our student services team and is a central part of what we do as a welfare provision. So we really are there to support everybody to move in, start university, have a great time, really get underway with your studies, and really get you off on the right foot in terms of university and on into your future career. So it's a big part of what we do. And I think halls is a really terrific opportunity and a really excellent thing to do in your first year. So that's largely it from me. we've got some of my colleagues who are in the chat already for this webinar, so you can dive in and ask them questions. If you've got anything else that you'd like to know, you can contact us through the inquiries team. They'll pass on any individual or complex questions, and we're very, very happy to answer them. So please just ask us. And a slight bonus for me, I'm aware sometimes that we don't just have future students looking at this, but we also have mums and dads looking at this as well. So if you're a mum and dad watching, or you want to let them know a few things if they're concerned, here are a few things that I'd like them to know as well. So the first of that is George's is one of the safest campuses in London per the Metropolitan Police stats. We are a very safe place. We're in a very, very safe part of a big city. Students don't behave as you'd imagine is another thing I'd like you to know. Our students typically, as are many university students, our students typically are in employment. They are typically involved in community activities. The local community is usually very pleased to see our students coming rather than the opposite. They really are a huge boon to the local area. And so our students are not as students might normally be perceived to be. Universities, and George's included, will offer support and training to new students and don't pull any punches. We do anti-racism training in our first week. We do anti-sexual violence training in our first week. We don't pull any punches about what our community is about or what sort of profession that folks are trying to get into. So that will happen in the first week to keep everybody safe, to introduce them to community and really get them thinking about what's going to come ahead. We usually can't talk to you without the student directly requesting. And lastly, having the talk, and I don't mean that talk, I mean a talk about finances, is hugely invaluable and really, really is probably the best thing that you can do for a student before they get off to university. Anyway, that's my time. Thank you very much for listening to me today. Again, there are folk available for questions in the chat, and we're available really from now until you start and right the way through if you've got to ask us. My name's Gavin Taylor. Thank you very much for coming to see us today online, and we look forward to seeing you in the future.
Okay, hi everybody. I hope you enjoyed that video from the Student Services team. It was very informative, I thought. I can see your questions are still coming in thick and fast. Please do keep sending them in and we will aim to get as much responses out as possible. I will just confirm again that any questions that we are unable to respond to today, we will send an email out with responses to them to all registered guests. So all questions will be answered at least within the next few days. Okay, so we're going to move on to the next segment, which is a presentation from the SU Vice President. So I believe we should have George logged in to speak with you guys. George, if you're here, please turn your camera on. Awesome. Hi, I will hand it over to you now.
Hi, I'm George. I'm the current Vice President for Education and Welfare within the Students' Union. I'm going to be handing over to Elgin, who's taking over from me next year, to go through the presentation we have for you today, and then I'll add any additional information and allow and take any questions.
All right. Yeah, hi guys, my name's Elgin. I'm, like George said, I'm going to be the next VP. And yeah, I just wanted to introduce the Students' Union for this year. So yeah, next slide. Yeah, so what are we? We are an organization running alongside the university, focused on representing students, and we do that through having year reps in each of our courses, exec, and yeah, and focus on amplifying their voice and making their student experience like as good as it can be. Yeah. So some key areas that we have in our SU are the SU shop, where you go to like buy food, drinks, and snacks, and our SU bar, that's on like our second floor of our building, where like you go to have like drinks in the evening, and then for the rest of the day, it's just like a general space to go there and study before like the bar itself opens, and like the location and opening hours are like listed there. Some facilities that we have is our games room. It's a really nice place to like relax and socialize. We have like a pool table, a place to do table tennis, and yeah, some seating just to have like lunch and study there as well. Yeah. We also have a music room, and that place is right there for playing music, a nice place to unwind. People get together in groups and bands to go there and play it as well. And then we also have like a dance studio available for groups and societies as well to use however they wish. Yeah. And yeah, here's our social medias that you, if you wish to follow, are available there. Yeah, thank you. And that's mostly what we had.
Yeah.
Went through that quite quickly.
Yeah, went through quite quickly. There's one thing that isn't on the slideshow today that I wanted to highlight as well. On the second floor near Students' Union, we have the welfare room, which can be used for breastfeeding or for anyone with particular welfare needs to take some time out and have a space to go to. We also provide a welfare support within the SU. So myself, Elgin, and a permanent staff member called Lon, we provide support on a lot of any sort of issues that come up during your time, whether that's issues with starting at uni, issues with your academics, anything like that we can help with. Yeah, and sort of beyond the central Students' Union, we also have all of our societies and our clubs. So these are all our sports clubs, all of our societies, cultural, academic. There's hundreds, loads to get involved in, lots of shows as well. So yeah, any questions are absolutely welcome.
Thank you for that, George, and soon to be Vice President as well. I'm just going to look through the questions that have been sent in just to see if we have any that are SU focused for you right now while we have you. Give me one moment. Right, there aren't any that I can see right now that are SU focused, but one question that you could possibly answer is it possible to, or how much engagement in SU clubs and societies can current students on the medicine program actually have? Is there time to actually get involved in SU clubs and societies?
Yeah, this is a question, especially in the last few years, that's become a focus for a lot of students. What I'd say is myself, I've been involved since when I started. I was in 5 societies. Obviously, I dropped that down to be a little bit more manageable, but still, you find plenty of time to be involved in 2 or 3 societies, especially with sports societies. They run on a Wednesday afternoon, which you have off of teaching anyway. So you have that time away that you can use to go and do sport, and it's a really nice time to just get away from university and go out and do a sport somewhere else. Yeah, there's definitely plenty of time, especially in your first and second year. You have a lot of time within your timetable to do some of the revision anyway. So outside of that, and a lot of the societies recognize that, so they keep going. All their events are from 5 p.m. onwards outside of your teaching hours.
Awesome. Okay, thank you for that. So we will have our SU Vice Presidents available to type any responses to questions that you might have from now until the end of the event. So if you do have any more SU questions to send in, then please do, and these guys will be behind the scenes ready to respond to you. So thank you so much for joining us today, guys.
Thank you.
Thank you.
Yeah, see you in the
Thank you. Okay, so what do we have now? So we're only 10 minutes ahead of schedule, which I think is quite good because I can see you guys have a lot of questions. So please still keep sending those in. And what I'm going to do now is ask our students to join us back on air. So if our current students can turn on your cameras, what we will do now, from now until the end of the event, is answer your questions live. As any questions that we're unable to answer because we need to go and maybe look at some data, as I said before, we will send those responses out to you in an email following the event. But for now, all my current students are going to turn on their cameras, join us live on air, and we're going to start our live Q&A with the questions that you guys are sending in. And if we do still have Laura around as well, Laura, please join us too, to help us answer some of these questions from our potential students. Awesome. Okay. Hi, thank you guys. So I'll read out the questions, and anyone who wants to answer them can do so. Maybe I might ask for a couple of viewpoints or opinions, depending on the type of question it is. So the first question, somebody has asked, what is a bursary? So I guess this maybe refers to the NHS bursary that you guys might be able to get as part of to cover part of your tuition fees. Would anyone in their own words like to explain what a bursary is? All right, go on. Thank you, Fahima.
So essentially a bursary is just a sum of money that is given to you either by George's or the NHS as well. And it's money that doesn't need to be paid back. It's just to help with kind of living costs, and also, so for example, George's give a bursary each year. I think at the moment it's around 1,000, but I might be mistaken. And then when you're in your final couple of years, it depends if you do an intercalation or not. If you do an intercalation, it's your final 2 years, but if you don't intercalate, then it's your final year. The NHS also provides a bursary in those years, so they pay for all of your tuition fees for those 2 or 1 year, and then you also are provided with a grant as well to help with living costs.
Awesome. Thank you so much for that, Fahima. And we have another question. Somebody has asked, is St George's University considered to be a campus uni or a city spread uni? Well, we tend to refer to ourselves as a campus uni, but technically we are in the city, and our halls of residence isn't actually on site where our lectures and halls are. It is up to a mile away. So technically we are a city spread uni, but everything is really in close proximity. I mean, we do have facilities that can be used from other campuses like Kingston University and things like that. What do you guys consider us as students at St George's? Do you call us a campus, or do you think we're city spread?
St George's is actually quite unique in terms of the type of university it is, because it's connected to St George's Hospital as well. So it's basically St George's has a few wings, a few buildings that are all connected to St George's Hospital in Tooting. And as Lanisha mentioned, there's also all of accommodation, which isn't really that far away. It's just a 15 to 20 minute walk away. And you also do have all the facilities you'd usually have in a campus university at St George's. Things like a music room, a dance studio, clubs, societies, and all of those are located in the main St. George's building. So I'd say it's kind of a mix of a campus and city uni, as Lanisha said.
Thank you, Mohib. And a question which maybe Laura can answer for us, and this is about A-level predicted grades. The question is, are predicted A-level grades higher than the minimum requirements? I guess they're trying to say, do your predicted grades need to be higher than what our minimum requirements are?
No, so if you look on the website, you can see what the minimum grades are, and that's what we'll take. Obviously, your place isn't confirmed until you get your actual results. So some people, unfortunately, do get made an offer based on their predictions and then don't achieve those predictions. But yeah, but obviously what you have to go on is your predicted grade. So that's listed on the entry criteria on the website.
Awesome. Thank you, Laura. And a question for our students. How do you find it studying in London? Are there areas available in St George's where you can study quietly, either in study rooms or in your own accommodation? I guess they mean halls of residence with that. So Mohammed, would you like to start with that one?
Yeah, sure. So I'd say at St George's, the university itself, is quite well equipped with different areas of study. So you can study in the library, which is split into different areas. So there's a silent area, silent area of study. There's a quiet area of study, and the vast majority of areas in the library itself have like a power plug, so you can plug your laptop in charge or your phone on charge. So it's quite well equipped in that respect. There are also base rooms in the universities across different floors, across different wings as well. And you can book those rooms, or if they're free, you can just sort of study in those rooms, and they're good for, you know, studying with mates, or if you're doing practicing for OSCEs or clinical examinations. There are, you know, a number of different spaces that you can do it. So the university is very well equipped to, you know, for studying within it. And also in halls itself, I think in every room, both standard rooms and premium rooms come with a desk, and I think the desk is pretty decent. And you know, there are a number of different areas that you can find yourself studying in, both halls and in the university. So that's not something that is a problem.
Excellent. Okay, thank you, Mohammed. And somebody has asked about the EPQ qualification, if we use that as part of our entry requirements and things like that. And I'll just answer that quickly. No, the EPQ, the extended project qualification, we don't use that as part of our entry requirements. So whether you do, yeah, that's not considered. That's not part of our entry requirements. And so we'll be looking at the, you know, your A levels, your GCSEs, the UCAT, and work experience and things like that. Another question. This is about, I saw a question here about work. So do any of you guys have a part-time job while studying here at St George's? And if you do, how are you finding that working and studying? So do any of you guys have any part-time jobs? Okay, so I think the only job which I think all of them have in common is that they're student ambassadors. So this is the work that they're carrying out right now, being part of this event. So at St George's, we have a scheme for current students to become student ambassadors, which means around their studies, where they are free to do so and where they are willing to do so, they can sign up for jobs. And what type of jobs have you guys worked in during the past as a student ambassador at St George's? Maybe Mohib, I know you've done quite a few jobs.
So yeah, I've been a student ambassador for the past 5 years now. And there's a massive variety of different things that you get to do being student ambassador. One of them is what we're doing right now, which is basically running and helping out during events, such as open days and offer holder days, those kind of things. There's also a widening participation aspect of student ambassador, where you work with the widening participation team, and you work with schools and students who are from disadvantaged socially and economically disadvantaged areas, and you go and talk to them about medicine. You show them what happens at university. You also get to sometimes teach them certain clinical skills. There's a lot of presentation as well, so you get to do presentations, do road shows in different schools, and show them about, give them more information and show them practically what different courses at St George's and at university include. So there's a lot of practical things. There's a lot of event organizing. There's a lot of presentation. So yeah. And additionally, I also did do a few other jobs. You can also, once you're in your third, fourth, fifth year, you can start working as healthcare assistants as well at the hospital. which is also a kind of shift work where you decide when you're free and you can go in and work for those at your own convenience. Obviously, if it doesn't affect your studies, and if you are already in med school, there is a good chance that you will get accepted to those jobs at hospitals. Additionally, I also worked a bit at sort of Wembley Stadium, selling merchandise and working in the restaurants over there. So there's obviously, since you're going to be in London, there's going to be ample opportunity to do things around if you're a little short of money or if you just want to save up some money. And you do end up making time for it. It's not that difficult, in my opinion.
Thank you very much for that, Mohib. And somebody has asked if St George's prohibits students from getting jobs in their final year. I guess Mohib, being a final year student, do you want to answer that one for us?
No, St George's doesn't prohibit you from doing any jobs at all. You can do as many or as little jobs as you want, but obviously you just always have to be mindful about it impacting your studies. At the end of the day, during that time period, it would be more important to do well in your exams and make it through med school so you can actually start doing a full-time job. But I've done student ambassador jobs during final year as well. I've done healthcare assistant jobs at St George's A&E during final year as well. So it's all possible, provided you're being careful with your time.
Thank you. And a question that Laura could help us with. Under what circumstances might we require a qualification higher than A-levels for an offer? I think I read that wrong. Under what circumstances would you require higher than 3 A's for an offer?
Hey, sorry, I just lost my mute button. So we don't explicitly state that, I'm afraid. So you may receive an offer between AAA and A-star AA.
Okay, thank you. How early do you have to decide whether or not to do an intercalated degree? So have any of our students here done an intercalated degree, and when did you decide to do so?
Yeah, so I did my intercalation after second year, but you don't need to do it after second year. You can do it after third year, you can do it after fourth year. So you have quite a lot of time to decide whether you want to do one. And yeah, it really just depends on your personal preference at the end of the day. And yeah.
Thank you, Fahima.
And to add to that, I don't think there's a wrong time or right time to do an integrated degree. I initially was planning to do it after my second year, but I ended up doing it after my third year, and I don't think I lost any time or was wrong in doing so. So I think there's no right time, and equally there's no wrong time in doing it.
Okay, thank you. Is the library open 24 hours? Do any of you guys know the library times? I know that they're... Sorry, go on, Mohib.
Generally, the library is open 24/7. It does close during bank holidays and during sort of Christmas and Easter and things. But even then, the computer rooms are open 24/7.
Yeah, and after certain times, like certain times in the evening, then the staff in the library are limited. So you wouldn't necessarily be able to do everything you could do at 10 o'clock in the morning, at 10 o'clock at night. But yeah, generally the library is open 24 hours. So you have that space to use. How does the workload compare with A-levels? Charlotte, do you want to start us on this one?
Yeah, so I'm going into my second year, so I finished my A-levels, or I did IB, but I finished my A-levels last year. Like I was saying before, I think my big concern coming to medical school was everything was going to be really, really difficult. I wouldn't say the first year was difficult. I would say it was just a lot of content. Like a term in A-level, which is like a few weeks at medical school. And then I got to my exam, 6 weeks for my exams, and I was like, well, I have a lot of content to review. So I would say really research into sort of different techniques you can use to sort of memorize a lot of content. And my biggest piece of advice would be to just do it as you go along. The people that I know that really struggle with exams left it to the last minute, and cramming in medical school is not something that it's just not, you can't do it. Like, there's too much content to be able to successfully cram it. So my advice would be just to do it as you go along. And if you're feeling daunted, do speak to the older years, because they will tell you, okay, maybe we can do a revision session on this, or maybe you should miss out this, or maybe this is the big focus for this exam. So yeah, I would say it's definitely more, but it's manageable.
Awesome. Thank you so much, Charlotte. And somebody asked if being a student ambassador is a paid role or a volunteering role. So being a student ambassador is most definitely a paying role, and we meet or exceed national minimum wage. So I think our students are paid quite nicely for the work that they do for us. And I know that they also themselves, and they can speak on their own behalf, but from feedback I've had, actually enjoy the work that they do. So it doesn't really seem more like hard work. It's more sharing their own experiences and, you know, encouraging potential students through their own experiences, rather than, you know, a hard work type job. Fahima, would you like to add anything there? What has
Yeah,
it been
I mean,
like?
I haven't had a lot of experience as a student ambassador yet. I only recently kind of started taking up jobs for it, but the jobs that I have taken, yeah, they haven't felt like work at all. I recently visited a primary school just to answer their questions about university, and it was really nice actually, and it was just an easy way to make money. So yeah, I highly recommend it.
Awesome, thank you. And somebody asked, what type of work experience do you need? So I guess that's in terms of applying to us. So maybe a couple of you can talk about some of the work experiences you had before applying, or up until your interview at St. George's. Who would like to kick us off?
Yeah, sure, I don't mind. So I primarily had 2 work experiences, if I remember correctly. So I had work experience, or a voluntary thing, at a nursing home, which I did, I think, every week for about 3 or 4 months. So I had that, and I mentioned that in my personal statement, and I think at interview. And the second thing was I had a hospital-based work experience, which where was I? I think I was on an obstetrics and gynecology ward for a week, and that was pretty much it, I think. I think the important thing with the work experience, or any voluntary thing that you do before med school, is it's always important to reflect upon what you've learned. So it's not necessarily just the experience itself, but it's important to showcase the things that you've gained from the experience, particularly on your sort of first statements and an interview, because that's what really shines across. It's all well and good having done a month across 10 different specialties in a tertiary hospital like St. George's, but if all you're mentioning is the experience that you've done and nothing else, then it's not really what you're not, you're not really maximizing the experience that you've gained. So that's what I'd say.
Would anyone else like to add anything to this point?
I can jump in just to reiterate what I said in the talk, which is that we currently have relaxed work experience requirements. So we don't require you to have medical specific work experience, because that has been really difficult to get during the pandemic. So exactly what Mohammed said, we're looking for you to demonstrate your values and skills and attributes that we think make a good doctor, and you can do that in a multitude of ways. The interviews that we do are multiple mini interviews, so it's not a panel interview, and multiple mini interviews are station based, so it's normally 7 or 8 different stations, and some of them will be asking you a question and gives you an opportunity to demonstrate that you've thought carefully about career in medicine and that you've done some things, particularly things like voluntary work, community work, that mean that you can then, as Mohammed said, reflect on your experiences and relate that to why you think you would be a good doctor. But at the moment, it doesn't have to be medicine specific, so it can be broader than that.
Thank you very much for that.
Just want to add, it's also worth noting that there's a lot of online work experience courses available now as well because of the COVID pandemic. I think there's a link available on the website in the entry criteria section of the medicine section of the website, which outlines a few online courses that students can do as work experience to sort of gain a better understanding of being a healthcare professional, which is one of the main aims of the work experience criteria of the application process.
Thank you, Mohib. I have another question here. What do you mean by reflecting on work experience? What kind of things should you be talking about? Laura, do you want to continue on the point you was making? Sure. About?
So reflection means you take your experience and you relate it to what you've learned about yourself, and what you've learned about things that you think are important to be a doctor. So that might be working in a team, it might be working under pressure, it might be communication skills, it might be caring responsibilities. So we want you to take your experience and relate it to why it demonstrates your values, skills, and attributes that would make you a good doctor, rather than just tell us about what you've done, which I think is what Mohammed was saying.
Thank you. So just to say, we've got a few minutes left of this webinar. There's still a few questions in the inbox. Some of them will definitely be responded to via email, just so I can confirm some data before sending out some information. So we'll just get through the last few emails that I can see we can respond to in here. And if there are still more questions that you do have, please do send them in, because I will have all of these questions noted down so I can respond via email as necessary. So another question here is, can you have a social life while studying medicine because of the amount of content? So any of our students can take this one.
Yeah, I don't mind starting off. I mean, you can definitely have a social life at the same time as starting medicine. So in my first year and second year, I found that I had quite a lot of free time. So I ended up kind of doing a lot of social activities with my friends, even though I wasn't necessarily part of like societies and stuff. I definitely would have had time for that if I was. In third year, I'd say I had a little bit less time, but I still had time to do the things that I wanted to do. And even now, at the beginning of fourth year, you know, I'm having time to do this today, whereas like I could have been doing social activities as well. So there's definitely time to do the things that you want to do. It's just about kind of organizing your time and being good with your time.
Sorry, had you finished your point, Fahima?
Yeah, I finished.
Okay, sorry. Okay, thank you.
Lanisha, I think you're on mute.
Thank you, Laura. I was just saying I'm not going to respond to any more of the questions about work experience that I can see in here, because I think yours and the students' responses have covered those quite clearly. How many applications are usually accepted? So how many places do we have each year? I know, I'm sure the number changes.
So it does change, and I can't really tell you how many places we're going to have next year because it's a moving target. Our overall intake every year is 250 to 270 places. That covers both of our courses, plus there are some students who transfer from the biomedicine course into the third year of the medicine course. So overall, the number of places, but because we have deferrals from the year before, the number of places changes. If you look on the website, there is a page called Admission Statistics, and that gives you the number of places for the last few years. So that will give you a clearer picture.
Thank you. Thank you very much for that, Laura. Is the bursaries available to international students? So I guess that would be the NHS bursaries that you guys can get. Is that just available to home students, or can international students receive that also?
From what I know, the NHS bursary is only available to home students, but during the last few years, so years 4 and 5 of medicine, the university does cover transport costs as well as accommodation costs within certain limits. As well as that, the university also has a hardship fund for international students, which they, according to, they assess your financial situation, and then according to that, they're able to give you a bit of financial assistance as well. But the NHS bursary is only available to home students.
Thank you. Thank you very much. I think that might have been the last question that we are going to respond to. Okay, one final question here. What is the process from transferring from biomedicine to medicine, and is this transfer possible? So what I can say about this transfer, which I think Laura might know as well, that students that are applying to biomed to start this year will be the last set of students, or the last cohort available for the internal transfer that we have at St George's. So we do have a transfer where students that study on our biomedical science course, they successfully complete the course and achieve a certain grade, can be considered for the internal transfer. They do have to be interviewed after their second year, and they could be considered to transfer in to our medicine course. But that option is only available for those that start in 2022. So people that start biomedical science from 2023 onwards will no longer be eligible for that internal transfer route that we have. Yeah, so if you are applying this year to start next year, and then unfortunately that option to do the internal transfer won't be open to you. And so I hope that covers that point. And I think there is where we're going to wrap up this event. So I would really like to thank everybody that has attended this event this afternoon. I hope you gained a lot of useful information from our students, our admissions tutor and our SU execs. If you do have any questions that pop up after this event, please do send, well, first I would advise you to visit our website for the most up-to-date information on our fees and criteria and all of those things. And then if you still have questions outstanding or something that you just still can't fully understand from the website, then please do email our inquiries team on study@sgul.ac.uk, and they'll be more than happy to answer any remaining questions that you have. So thank you all again for joining us, and I wish you guys a pleasant evening, and we look forward to hopefully receiving applications from you guys in the very near future. So thank you everybody, and goodbye.